Hi everyone, my name is Diane and I am a clinical exercise physiologist with True Fitness. So today's health workshop is on balance training, specifically for middle-aged and older adults. And this is a really interesting topic because balance is often forgotten about unless you happen to be on a very structured falls prevention program. And if you are, it's likely that you've experienced frailty and one or more falls. So we wanted to highlight balance training because really we need to focus on this in middle age so that we can prevent things like falls as we get older. And we know in middle age, the levels of strength and fitness and balance and flexibility that you have in middle age dictate basically your health and your frailty moving forward into older age. And interestingly, we undertook some research with Laois Sports Partnership last year where we surveyed 353 middle-aged and older adults in Laois. And we asked them about the types and amount of physical activity that they were doing weekly. So resistance training, aerobic exercise, flexibility training, and balance. And nobody was taking part in any form of balance training. So zero people. And this may have really important implications for falls as they age. So the purpose of today is to highlight the importance of balance training and look at how much you should do depending on your falls risk. Okay, so balance training. So how much should you do? And the answer to that depends on your falls risk. Okay, so we have clear guidelines for older adults, but this is really something that we need to be looking at far younger than that to ensure that we don't have problems as we age. And in terms of your risk of falls, I have it broken down today into three categories. Okay, so if you're low risk of falls, you should do some type of balance training 2 days per week. If you are medium risk of falls, you may need to increase that to 3 to 4 days per week. And the people who would fall under this category would be if you perceive that your balance is poor, if you perceive that you have poor leg strength or strength in general. So if you're not taking part in any form of resistance training or you're not physically active, you will likely fall into this category for sure as you age. And also if you have osteoporosis. So if you have an issue with your bone quality, it's important that you don't have a fall just in case you have any of the adverse consequences associated with that. So if you are high risk of falls, you may need to do much more intensive balance training 4+ days per week. So if you have had a fall, if you have a history of falls, especially if you are experiencing frequent falls, if you are frail, if you're chronically inactive, if you're combined with being an older adult, and if you likely have sarcopenia. So we talked about sarcopenia in one of our previous mini workshops associated with this Launch-A-Care project. It's depicted in the image there of the sedentary 74-year-old male on the right of the screen. And sarcopenia basically means a reduction in the amount of muscle you have and in its strength and function. And this would be the inevitable consequence of age, but it's magnified in people who are inactive for a number of years. So if this is you, you definitely need to work on your balance, but also your strength training. And in the case of the high risk of falls, you may need an individually tailored and more intense falls prevention and balance and strength program. And the great thing if you do is that you respond really, really well to it. And of course, if you need some help or advice on this, please feel free to contact us. We've been helping some of our own Launch-A-Care participants with this as well. So how much balance training should you do? And we look at this in the context of the FIT principles. So in terms of frequency, you should do 2 to 4 or more days per week, depending on your risk category. So we've just discussed low risk, medium risk, and high risk of falls. And depending on which category you fall into, that will dictate the frequency of balance training that you should do. The intensity is low because it doesn't require much cardiovascular effort to complete this type of training, but it does require a certain amount of strength, and we will talk about that as you move forward. In terms of time, 5 to 10 minutes per session is enough. So we don't need to do hours and hours of balance training. Just a small amount will make a massive difference to you. And in terms of type, I'm going to, in the next 2 to 3 slides, talk you through some practical examples of balance training because you may not be familiar with this type of training. It seems to be something that is really not considered too commonly. So we'll talk through those. Of course, it would be easier to show you some examples, and in that case, we have actually created a number of videos for our Sláintecare participants and sent those to them. But if you would like to avail of these, they're all free resources, please contact us and we will be very happy to send them to you. And a lot of these are based on recommendations by the American College of Sports Medicine. Okay, so some examples of some balance exercises that we are doing with our Sláintecare participants. Now, keeping in mind we have people between the ages of 50 and 80. They have different levels of conditioning, different training backgrounds, different injuries, different clinical conditions, different falls categories, and so on. So basically the sessions that we do, we've given everyone different options. So for easy, medium, and hard, and they choose from that. But just as an example, some of the basic things we would have started with in terms of standing exercise. We ask our participants to stand on one leg. So for example, their left leg, and they stand up straight. They raise their right leg out straight in front and hold for a couple of seconds. They return to a standing position. Then they raise it to the side. They return to the standing position. They raise it straight behind, return to their standing position, and then they bend their knee and lift it to their chest and hold for a few seconds, and then return to the standing position. Now, as they do this, we ask them not to let their upper body move. So they need to stand up good and straight, and it's only the leg that's moving. So that requires a lot of balance to keep your body in that position. So don't let it move sideways and forwards and backwards. It's to keep your upper body in that neutral position. And then, of course, you swap your legs and you repeat. So that would have been the basics of the exercises. And in terms of giving different options for people, they were given the choice of performing these exercises with or without the support of a chair, a wall, or a partner to help them. And of course, if you use some type of support, that makes the exercise easier. So that's very appropriate for people who are at high or medium risk of falls. And if you do the exercises without support, so for example, if you're low risk of falls and you have good leg strength, then it makes the exercise much more difficult. Okay, so we introduced something called a stability cushion to the group, and this is an online program at the moment. So of course we couldn't use it over online means, but we normally do in class. But just to give you an example, because you can buy a stability cushion very easily online if you do want to use one. And basically you put the cushion on your chair, and because it's semi-soft / semi-hard, when you sit on it, it moves. So you have to sit upright, keep your feet firmly flat on the floor, and stabilize your base of support, so which is through your hips, on the cushion. So once you have yourself sitting upright, straight away you're challenging your postural muscles. And then what we would do as the starting point of exercises is you lean away from your base of support. So you lean to the left, lean to the right, lean forwards, lean backwards. You can even do circles clockwise and anti-clockwise with your torso. And all of this stresses the postural muscles. But of course, you need to be careful and make sure that you're safe. And it could be useful to have a partner with you. Not necessary in the case of those who are at low risk of falls, but possibly necessary if you are in the medium and definitely high risk categories. To make it more difficult, you can do everything that we've just mentioned, but take one foot off the floor as you lean. And then the more advanced version would be to do the same thing again, but take both feet off the floor as you lean. So this challenges the postural muscles quite significantly, but it also becomes an abdominal workout too. Okay, and then you can perform all of the standing exercises I just outlined, but you can actually do them standing on the stability cushion. So you can imagine once you stand on the cushion, of course, it's going to challenge your balance. So please initially, if you've never used this equipment before, use a chair, a wall, or a spotter, which is just a helper, for balance until you get used to this. This is only appropriate if you have completed some basic balance training and also if you are at low risk of falls. It's not appropriate for high risk of falls or medium risk of falls, but it is definitely something if you do enough training that you can progress onto. So it's a really nice piece of equipment if you would like to use it. And of course, you can do everything that we just said there without the use of any equipment. Okay, so on the top right-hand corner, you can see a piece of equipment which is called a Bosu. And we would use these in our classes, of course, in the pre-COVID days to challenge strength and balance. And so basically what you do on it is a number of like squats. So you would stand on top of the Bosu and do your regular squat, but this really challenges strength and balance. It makes it a completely different exercise. You can also do lunges off it. So you put one foot in the center of the Bosu and then you lunge in different directions off it. But of course, you would have to have good leg strength and balance to do this. You can stand on it with your 2 feet and you can rise up onto your toes and then back down onto your heels. And this is a really challenging exercise. Some of the easier ones on the Bosu would be just simply to stand on one leg and lift the other leg off. Okay, now you can lift it in front, to the side, behind, bring your knee to your chest, but often even just lifting the second leg up is quite a challenge. Okay, so that would be definitely for more advanced balance exercises, but just to let you be mindful of where this can go, especially since it's often a forgotten component of fitness training. Okay, so also you could do the beginner balance video that we created for our Sláintecare participants, and if you'd like to get a copy of that, please contact us and we'll send it, no problem. Dancing is a really good balance exercise, and of course it's fun. So it often involves reducing your base of support, shifting your weight around your center of gravity, and it challenges your sensory input because you're moving in different planes of motion. So dancing is a really good way to challenge your balance, and of course it's fun, which makes it all the better. If you're into technology, there are some things like, for example, you can download the Clock Yourself app, and this app asks you to imagine that you're standing in the center of a clock. So, and it points out where 12, 3, 6, and 9 is. And it'll ask you to stand on one leg and move the other leg in direction of a particular time on the clock. And it'll make things quite challenging for you, and it can actually, there's different levels on it, so you can work at higher speeds or lower speeds. So that's just an example of technology that you can use. We just use our own version of that in class. So John gets people to imagine the clock and he asks them to do different actions in the direction of the clock. And even though it's an online program, it works really, really well, and it can become quite challenging. So it's a really nice thing to do. Throwing and catching exercises are really good as well. So you can be either seated or standing, and you can either do this yourself. So if you want to throw the ball against a wall and just throw it, high, low, side to side, and different points on the wall, that's a really good option for balance. And if you don't have a partner that you can do this with, it's great that you can just do it against the wall. Ideally, if you do have a partner, of course, it's a lot more fun. We would have done this an awful lot in different groups, and it actually brings a lot of fun to the session. What I would say is, if your balance isn't good, I would choose a larger soft ball, because as you reduce the size of the ball that you're throwing, the exercise becomes much more difficult. But again, something you can do at home, it's inexpensive and you don't really need a whole lot to do it. Just a point to note that walking over uneven terrain challenges balance. So if you are in the high risk category, we wouldn't recommend that you go walking across the fields or on uneven ground, because it does challenge balance, and if you don't have good balance, it's a problem for potential falls. So if you are walking or running over uneven terrain, to let you know that you're also, as well as training your fitness and your strength, you're also training balance. So just a point to note there. And of course, multimodal programs are always best. So if you want to improve your balance, you should also do your strength work, your flexibility work, and walking as well are really good, just to train all components of fitness together. So there are a number of things that you can do if you haven't been doing balance work, or if you have and you want to push it on a little bit more. And these recommendations would come from the American College of Sports Medicine as well. So one of the things you can do is gradually reduce your base of support. So for our participants who have been doing certain exercises with their feet, we'll say at least shoulder width apart or even more. Over time, as their balance gets better with training, we will ask them to put their feet closer together, and that will make the level of effort or the level of difficulty greater. Also, if they have been doing some exercises standing on 2 legs, we will reduce that over time to a single leg, obviously when safe to do so, and we will probably ask them to use a chair, a wall, or a partner as well at that time. Okay, so you should stress your stabilizers and shift your body weight around your center of gravity. And that brings us back to the examples of leaning forward, leaning back, leaning side to side, and even simply going from your both feet flat on the floor and raising up onto your toes. That's a really good exercise, really simple to challenge your stabilizers. And also you're shifting your weight around your center of gravity. You can reduce your sensory input because a lot of the balance comes from what you can see. So if you're doing a simple balance exercise and then you close your eyes, it becomes a completely different exercise and quite difficult to do. So obviously we would not recommend this for people in the medium or high risk falls category. But for some of our other participants who are very low risk of falls, they're quite strong, they have training background, over time, we would probably do some of these exercises with them because it's appropriate to do so. And reduce your contact with supportive objects. So for our participants who have been using the wall or the chair to help them, over time, we are trying to train them so that they won't need these supportive objects in time. Of course, you can introduce new equipment like the stability cushion and the Bosu, and they will challenge balance to a greater degree. But one of the big things is if you want to improve your balance and reduce your risk of falls, you really need to strengthen all of the muscles in your legs, because the stronger they are, the less likely you are to fall, of course, but also the more you can push on with your balance training, because once you start to do balance training, you'll realize it actually requires a certain amount of strength in the legs. So the stronger they are, the better the quality of your balance training. And when you combine increased strength with increased balance, that significantly reduces your risk of frailty and fall. So that would be the ideal combination. Okay, so the benefits of balance training. If you do it, of course, it will improve your balance. This in turn will reduce your risk and incidence of falls, and of course, possible fractures or breaks that may accompany that. It's really important for quality of life and functional independent living as we age. So did you know that the stats at the moment in Ireland are that 1 in 3 older adults will fall every year, and most of those will have a second fall within the next 6 months. And it's not just the fall, it's the consequence of the fall. So injuries, disability, hospitalization, and all of these things affect really seriously their physical health, their mental health, their functional independent living, their quality of life, everything. So while this is why balance training, while it's often not really incorporated into many training programs, it is so important that we train it, because the type and the amount of balance and leg strength that you have, particularly in middle age, they're major predictors of falls in later years. So it really needs to be trained. And as always, we have some health homework that we would recommend that you do. So write down how many minutes of balance training you currently do per day for 1 week. And if you're on our Sláintecare project, you can count each training with us as 5 to 10 minutes of balance, because the rest is made up of aerobic exercise, flexibility exercise, and resistance exercise. Do you meet the recommendations for health for you? So the answer to that question depends on whether you are low risk, medium risk, or high risk of falls. And we have, of course, covered that earlier in this presentation. Now, it's quite subjective, like this is based on how you feel and how you would categorize yourself. Of course, there are much more clinical assessments that we do to determine falls risk. But when we're doing a generic workshop like this, it's just to make people aware of the different types of fall categories. So how can you increase your balance training? So some suggestions would be to perform the balance video for beginners that John sent to our participants. And of course, if you'd like that, we can send it to you. The training sessions that we do incorporate balance for our participants. Definitely you should work on your leg strength. So start incorporating squats into your routine, lunges, sit to stand. So that means you're sitting on a chair and then you move from that position to standing and then back down again. And ideally you should be able to do that without the use of your hands or arms for support. And that would denote that you would have good leg strength. And this would be really important again for avoiding frailty and falls as we get older. So there's some really simple exercises you can do at home. Whole body resistance training is a good option as well. And of course, we have loads of home-based videos for anyone who would like to avail of those. And you could practice maybe one of the examples we outlined in today's health workshop. You will get a lot of benefits from this. Balance is completely overlooked. It's so important and it makes a massive difference to falls prevention and the issues that come with that as we age. As always, we have provided our participants with additional practical resources. So we have sent our Sláintecare participants balance training videos that can be done at home, and we will continue to create these. And if you'd like to avail of them, please let us know. You can contact myself, Diane, or John, our strength conditioning specialist. So we would be happy to send those to you. So it's www.truefitness.ie or info@truefitness.ie. In terms of recommended reading, these are probably more for practitioners, but a nice simple paper that is the exercise and physical activity recommendations for older adults by the American College of Sports Medicine. There are numerous clinical exercise physiology books. This one in particular, I probably would have used in this as part of this workshop, and it has a nice chapter on exercise for the older adult, and there's a nice section in it on balance. But there's lots of resources you can use. It's just to point you in the direction of some.